We are continuing on in your anatomy book. I'm on page 626, and we are starting up with now the female reproductive system. The previous videos went through all the male, and so now we're starting the female. So just like when we started the male system, we talked about the essential versus the accessory organs. Just like in the man, the essential organ is the gonads, which in the female is called the ovaries. Inside the ovaries are the eggs, also known as the ova, plural being ovum, and they produce progesterone and estrogen. The accessory organs are the uterine tubes, we call them the fallopian tubes, the uterus itself, the vagina, your external glands called the vulva, the vestibular glands, we also call those the Bartholin glands, and then the breasts, which seems a little odd since like they're not like connected to it all, but the breasts are part of the female reproductive system. So the ovaries, these are the equivalent to the testicles that you find in the man, so they are the gonads. Each one weighs about 3 grams, so they are not very large. They're about almond shaped, and they are attached to the internal structure of the uterus. I'm going to scroll down. There we go. This is a great picture to kind of see the overview of how it all fits together. So this is the uterus itself. Okay. The fallopian tubes come off to the side, and the ovaries are kind of connected here in this middle part. And so the egg itself is going to leave the ovary, travel through here and into the uterus, and that's where it will implant and the baby will start to grow. Okay. Then when it's time for baby to exit, we're going to go through the cervix and through the vaginal opening to get out. Okay. So it gives you an idea of kind of how it all fits together. So now when we talk about it in this text part, you can kind of have a visual of what we're talking about. So this is the ovary itself and what's going on inside. And so remember, when a woman is born, we have all the eggs we're ever going to get. Women do not continue to make eggs. We have them there from the beginning. And there are about 400,000 eggs inside the ovary waiting to go. Okay. And if you think of how many children you have, like I have 3, so like how many of those were wasted? Only 3 of those made them into, human beings. Okay. But just because only 3 turned into babies, now I did ovulate and my body released multiple other eggs that did not end up turning into babies because of birth control or whatever reason. Or even before sexual activity, you were releasing eggs before, it was even, you were, having intercourse. So obviously those eggs, went to nothing. But you can imagine if you ovulate every month, 12 a year, through how many years of ovulation, the majority of those eggs go completely unused. So this picture in the center of your screen really talk about what is happening inside the ovary from the entire cycle. Okay. The female body is on about a 28-day cycle with menstruation and ovulation, but there is something going on in the ovary the entire time. So we start here at the bottom. And it starts as this tiny little immature egg. It develops, and by the time it gets over here, we ovulate, and we release that egg from the enclosure. We then take where that egg just came out of, and we close it back up, called the corpus luteum, and we kind of fizzle it back into nothing. And then we start again with picking another egg to mature for the new month. Okay. So every time that happens, one of those 400,000 eggs gets picked as the one for the next month. Okay. Okay. The production of the female egg is called oogenesis. In med term, ooo means egg. So we say oogenesis, creation of egg, origin of egg. Okay. And just like in a man, when that egg is chosen to be the one that's going to mature that month, that egg contains all the genetic material that the mother is going to contribute to the creation of the baby. So we have 23 pairs of chromosomes. So the 23 that mom is going to contribute is in this egg. The 23 that the dad is going to contribute is in that sperm. And when the two of them join together, the baby has the 46 chromosomes, which is what a human should have. Okay, so we've got 23 pairs, and for each pair, you get one from each parent. We'll have a whole chapter on genetics coming up. Two different hormones that are coming from the female body are the estrogen and the progesterone. They are created in the ovary. Okay. There is some difference in what these two hormones do. Estrogen is the hormone that developed the female body, so it's the hormone that turned the little girl into the young lady. We talked about this in the endocrine chapter. It matures the sex organs. It kickstarts breast development. It makes the armpit and the leg hair grow and the genital hair grow. It gives them their curves. It distributes a certain fat distribution in certain places to give us our curves, and it kickstarts menstruation from the very beginning. So at whatever age that was going to happen, I believe the current range is anywhere from like 10 to 13, sometimes younger. Like we've really done some things to the human body with steroids in the food that we eat that have really increased or lowered the age of some of these things happening. And then progesterone is put out by the corpus luteum. I'm going to jump back to this picture for a second. Remember, the corpus luteum is only present in the second half of the cycle. It's this. Okay? It's not called the corpus luteum on this side. So if the progesterone is put out by the corpus luteum, it can only happen in the second half of the cycle, because that structure doesn't exist in the first half. Okay, so the corpus luteum is a structure that develops from the follicle that just released the ovum. So the egg just left the ovary. Maybe it'll become a baby, maybe not. And it produces progesterone for about 11 days. So it's from ovulation to menstruation is when this part happens. And this hormone stimulates proliferation of the uterus. The word proliferation means thickening. Okay? So what happens is every month your body is preparing for pregnancy. Okay? Obviously, we don't get pregnant that often, you know. But if you look back in your family tree and people had 20 babies or at least 20 pregnancies, lots of miscarriages and things like that in our genetic past, but your body every month is preparing for birth. So what's happening inside the uterus is the lining is thickening and getting ready for baby to implant and start growing a placenta. And I think of it as like getting the nursery ready. You know, if you're pregnant, you're getting the nursery ready. You're buying things, you're getting the bed, you're painting the walls, you're making it all pretty for baby to show up. And that's what your body is doing inside your uterus. It is getting the nursery ready. And then if you get pregnant, great, it's all ready to go. However, most months you do not get pregnant, and we then get rid of the preparations and we start over next month. When that lining of the uterus decides that you are not going to get pregnant and we're going to go ahead and get rid of it, that is your menstruation. That is what's happening, is that lining of the uterus pulls away. There's some blood there, and your body gets rid of it. Okay. Because these hormones are put out by your ovaries, if you do not have your ovaries, you no longer have the hormones either. Okay. So we'll talk about lack of hormones later on, but if you don't have the structure, you can't have the hormones. So just like in a man, we have reproductive duct, D-U-C-T. In a female, we call that the uterine duct, also known as the fallopian tube or duct. You have one on each side. You have 2 ovaries, you have 2 fallopian tubes. At the very end of the fallopian tube, down here, you have a structure called the fimbriae. And the fimbriae is like little fingers. Notice how the ovary and the fallopian tubes are not connected. There is a gap there. So the fimbriae are like little fingers at the end of the fallopian tubes that are going to grab the egg and bring it up. I almost think it reminds me also of like a vacuum hose, but it doesn't have any sucking action. So it's sitting there kind of grabbing the egg and pulling it upward. Okay? Because if the egg doesn't go up into the fallopian tubes, no baby can be made. So this egg could actually escape and go this way. Now, normally when that happens, your body just reabsorbs it, no big deal. But what if a sperm gets all the way out here and finds that loose egg? We have a problem. We have a pregnancy outside of the uterus, which is we've got a problem going on here, but it can happen. We'll talk later about some of those problems. So the fallopian tubes, fimbriae, these are about 4 inches long here in length. Okay. And this is normally where fertilization takes place. So the sperm has to get all the way up and out here. And of course, the sperm doesn't know which direction to go. So some will go each way. Some of them will get lost in there in the middle and can't find their way at all because, men never ask for directions, right? Just kidding. But you ovulate back and forth. So you're only going to release an egg on one side. So every other month, back and forth. Then we have the uterus. So the uterus itself is a very strong muscle. Okay, we call it the myometrium. Okay. That's the muscle. It's small. When you are not pregnant, it's about the size of a pear, and it kind of is all squished down. Okay, and it's really low in your abdomen. Okay, we have the body. We have the fundus, which is this top curved portion, and then we have the cervix, which is the neck portion here at the exit. A couple of med terms. I think it's metro. It might be /I, but I think it's metro. Metro and hystero both mean uterus in medical terminology. And so we can talk about the patient having a hysterectomy, which is a removal of the uterus. And then we talk about myometrium or endometriosis. They use the metro version of med term. So you just by exposure, you'll get used to which time to use which version. Okay. And then we of course have the cervix is the neck exit to the uterus going downward, and then you have the vagina, which of course leads to the outside world. Okay. Which of course is where the penis fits in to ejaculate. We have a couple of glands that are located there in the genital region. we have what's called the vestibular glands, also known as the Bartholin glands. And the lesser vestibular are called the Skene glands. Okay. Both of these glands provide lubrication during sexual intercourse. And of course, they can get infected through sexually transmitted diseases, things like that. So again, females need to pay attention to what maybe doesn't seem normal going on down there, and they maybe need to get checked out if they feel they have some disease going on. Same with men. And then we have the breast. The breast itself is made up again of ducts, D-U-C-T, because the purpose of the breast in the female is to provide milk to a newborn baby. So the milk secreting cells are arranged in the chambers called the alveoli, which that word may look familiar to you. We also have alveoli in our lungs, so that may be a word that's familiar to you. And the hormones, oxytocin from our brain, stimulates that milk to produce and to release upon breastfeeding. Externally in a female, the parts that you see are the pubis, the clitoris, the meatus, the labia minora and majora, the hymen, the openings, etc. And so the mons pubis is the top part here, which is like a fat pad, kind of at the top. The labia majora and the labia minora are literally, they mean large lips or little lips, and those are the folds that kind of cover everything up. The clitoris is here at the top, and that is the female version of the erectile tissue. What else we got here going on? The urinary meatus is where the urethra exits with urination. And then the perineum is the skin piece here between the vaginal opening and the anal opening. And then earlier we talked about the glands. We've got the Bartholin and the Skene glands, and they're kind of, the Bartholin are kind of here underneath, and the Skene glands are up here, but underneath the tissue. I mean, you don't see it. Probably can't even feel it. All right, I'm going to stop the video here, and we will start the next video with the actual menstrual cycle.